All right, everybody, so welcome to class. We're going to be doing the change of position skill. How frequently do you change your residence positions?
Every 2 hours.
Every 2 hours or more frequently if what? In pain. They could be experiencing pain or discomfort. All right, and so for the test, would you please straight? For the test, you're going to use 3 or 4 additional pillows based on what factor? The length of the legs. So I already have your table set up. This, of course, would have followed your introduction with your curtain being pulled, your hands cleaned, etc. Your patient has given you permission to touch the skill. To perform the skill. And then for our beds, remember they're not at a working height like you see traditionally in a hospital setting, but this is the home care beds that you have, and this is the highest that they go. Next thing I want you to state is position first and then pillow. So position first, let me hear you say it.
Position first.
And then pillow.
And then pillow.
Because if you do it the opposite way, you're gonna be walking around with a pillow that's touching you. And so your nurse is gonna mark you off for standard precautions. So we need to go ahead and get them in position first, and then we will go and get our pillows. At the test site, your bedside table and your pillows would be near you, but for classroom purposes, I have them against the wall. All right, so would you please talk to your residents to ensure they don't fall out the bed? How do you do safe turning? What do you have them do first?
Move over.
Move towards you. So talk to your residents, say scoot towards me. Go ahead, scoot towards me. Keep your knees off the bed, Rochelle. I'm already catching you. All right. And this person can do whatever you ask them to do. Anytime there's a human in the bed during the test, they will do what you ask. Ask them to turn away. What was your question, Rochelle? Go ahead.
I was gonna ask if I had to move them.
That's only for the mannequin or for in the real world when someone can't assist you. Right?
Okay.
She'll do whatever you say. You just gotta say it.
Okay.
We waiting on you to tell her to
Oh, can you go
Good job. All right, and so now when you get this pillow, it should not touch you. Arms extended. Get the pillow, arms extended. Now you're gonna place the pillow flat on the bed, starting off at their shoulder area. Flat on the bed, flat, flat, flat. Now, flat. And now lift her hair because her hair is going to be in the way. All right, and so my recommendation is with your strongest hand, which is probably your right hand, just lean your resident forward a little bit. So right hand on the resident.
Lean forward a little bit. There you go.
Push that pillow in, push, 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 and now you curl it. Push, 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 and now curl it, and then push that second layer in. Curl, curl, curl. One time, push, 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 push. Get it under. Don't be gentle, cause it's going to not only take time, it could pop out. So you want to get that pillow under her. And now just a little bit, just bring her back just a little. Good. And so now her body weight is going to keep that pillow in place. And now you would fix the covers on the side that you're on because of the test height. This will be done under a sheet. Carefully walk around. So, hey, can I get you in this chair? Carefully walk around to the front. Carefully walk around to the front. Remember, it was position first and then pillow. What position should the knees be in? Position first and then pillow. What position should the knees be? She's helping you out. She said curve. What's the B word? Bend. Talk to your resident before you touch their knees. Rochelle, get your legs off that bed. Rochelle, get your legs off that bed.
Can I bend the knees for you?
Oh, that's too much. That's a blood clot.
Oh.
There we go.
Okay.
Let your resident know that you're going to be raising her legs to put this pillow between her legs.
My legs. I'm just gonna
Raise your legs and put the pillow between your legs.
All right, and make sure the pillow is not in the crotch area. I know that sounds nasty, but the higher up that pillow is, the more it's going to be contaminated, and the less likely you will be to stop the toes from touching. So, Rochelle, what's going on with your pillow?
It's too high?
It's too high. And now it's curved. So, you want to have it going with the... Don't give up. You got it. You got it. She like, look now. Good, good, good. All right, and so yours is fine also. The upper hand doesn't pass or fail you. Just let them know you're going to move the upper arm. You're going to place it on their side. Take the upper arm, place it on the side. Communicate with your resident.
This one right here?
That's the upper arm. All right, and so now the lower arm, if you notice, especially over here, breast tissue, she's like laying on her arm. So you want to gently take the upper arm and move it out. 2 hands. That's the forearm. Get the upper arm. There we go. She ain't talking to you at all. Move it out. There we go. All right, now the next pillow goes flat on their chest. Usually the open end we do not put towards their skin, so towards their chin. So open end does not go towards the chin. Closed end does. So against their chest, flat against their chest. And now, and now you're gonna wrap her arms around. Wrap her arms around. All right, and so now what's the last pillow you have to touch?
The neck.
Thank y'all for helping them. All right, the head. So
I'm gonna position your pillow.
ask her to raise her head. Ask her to raise her head. And that pillow should be over the shoulder. The end nearest the shoulder goes over the shoulder. She pushed your head down. Your patient had to fix the pillow for you, Rochelle. All right, so if I can get you to trade places, all you're gonna do is turn around. If you'll come over here, what I want you to do is evaluate each other's beds. And you start off at the back pillow. So if you go to the back over here. All right, so did the back pillow pop out? Yes or no?
Nope.
That's good. Walk around to the front. Are the knees and the toes and the ankles separated?
Yes.
She did. She could have. Your nurse over here really right there. You tried your best. All right. So is the pillow in position? Her arms wrapped around it.
Yep.
And then how's the head pillow?
Right under, in between the shoulder and the chin.
And that's because the patient helped her. So when you come over here, would you do the same for your resident? All right. And you're gonna ask your resident to raise her head, and you're gonna bring that pillow more on top of the shoulder.
Go ahead and raise your hand for me.
Y'all discharged. Get on out the bed. Get on out the bed. Get on out the bed. Great job, team. Great job. All right, I need someone else in the bed so they can actually watch. The ones who just went are now going to watch the skill because they couldn't see it because they were in the bed. So I guess the ones who just performed.
Can I do somebody?
You ready to do it? You don't want to watch first? Somebody in the bed. Come on, y'all. Y'all know the rules. You can't perform if you don't actually get in the bed.
I think I'm gonna fall asleep if I lay down.
Come on,
What you see? We got 3 rotations. So there's 6 people. We got 3 rotations. Oh shoot! They really took every pillow from over there. Here, let me give you the pillow back.
You gotta be the performer. You gonna be the
But for right now, she can be in bed. And then she can get up and she can perform. But she didn't sing it once.
Portia.
Oh, I gotta perform.
Because you was just in the bed.
Oh, okay.
Ain't got to tell Kia twice. Kia about to go to sleep over there. Kia, lay on your back. Kia, you gotta be on your back. You can't help her out, Kia. Don't fall off that bed, Kia. Come on. Come on, let me help you over here. All right, get on over, sit in the bed. Okay. All right, we won't have you flap alone. So I no, ma'am, because I need to y'all starting off at the same point. You just pulled her right down there. All right, so safe positioning. Because y'all already cheated. Y'all patients are all the way. Patients get in the center of the bed. Patients get in the center of the bed.
Am I in the center?
No, ma'am. Right here. Yes, ma'am. That's the center. All right, so I'm not with y'all. All right, talk to your residents. Get them close to you. Y'all don't want to talk to your residents?
I don't have to sing on the. I'm here to do it.
Not for this part. Yeah. And now help point turn. How should they be positioned?
Okay, I'm gonna roll you over just a bit.
Good. And now after shift her weight, she did it for you. Position first and then pillow. Position first and then pillow. That pillow's a little too thick. I already used a very thin one for the back.
I can't breathe. You can't breathe.
But she can talk. And the pillow touching you. I don't know about this. This end has to go under. Push it under. This end, push it under. No, don't roll. You push. Get it under. And now curl it. Get it under her. And then bring her back. Oh, so what you're doing is you're being nice to her. Let me help you. You put one hand here. You lean her forward. You get that under. Get it under. Get it under. Now bring her back a little bit. Okay.
You good?
I'm gonna raise her head just a little bit so she can get. Make sure that pillow didn't touch you. I ain't
It
look
didn't
at you.
touch me.